So the topic of discussion today is how to deal with a plateau in your weight loss. And I was going to let Karla go ahead and start out covering a few topics, and then I'll finish up after that. So.
Cool. Yeah, we'll get started.
Okay, sounds good.
Awesome. So of course with weight regain post-bariatric surgery, there's a lot of different areas to kind of focus on. It's not just one root cause. There can be many things going on. So from my point of view and from what I see in practice, I'm going to go over a couple of examples. And bear with me because I have notes. I'm OCD of these things. Okay, so the first thing, of course, that I've focused on is, the nutrition, right? So what are you eating, how much you're eating, but most importantly, the composition. Because at this point, of course, we're not overeating, right? You have a little teeny tiny stomach, so you cannot handle a lot of food. However, it is a composition mainly that's where we get into trouble. So always my first question is going to be, how much protein are you getting, right? So typically protein in weight management period is going to allow you to stay full for a longer period of time. So it has that high level of satiety. And then number two, when our diets tend to be a little bit higher in protein than any other macronutrients, do have a higher thermic effect of food. So that means that when you're resting, chilling, watching TV, you are actually burning a little bit more extra calories than if your diet were to be higher in carbs or higher in fat. So that's clue number one. Usually whenever we don't meet our protein requirements, we're displacing that, and typically we're consuming a little bit more carbs. Right, so in order to make sure that you are on track there, typically I would ask to see a food journal. And if you're not doing that, this is when I ask you to come back in 2 weeks with your food journal. And that's why we have the app, and that's why we emphasize it so much, because it is a great tool to help you just stay on track with your nutrition goals, because maybe we're not seeing each other on a monthly basis as if we were at the beginning. So this is kind of like having me in your pocket, and that's like the reminder every day. Now another sneaky way where we can get some extra calories in, and where we can get into a little bit of trouble, is your liquid calories, right? So of course at the beginning the advice is to do anything low calorie, sugar free, and all that. But once we get a little bit more comfortable, maybe we're sneaking in a little bit of soda here and there. Maybe we're having juices that we think they are so healthy because they're green and they don't have any sugar added, but when you look at the label, it's if you were having 5 or 6 different fruits at one time, or maybe even going back to sweet teas, which is a very common thing here. So again, looking at that food journal, looking at those options. Another really common one that I see is relying too long on soft foods. Right? Of course, at the beginning, when we have surgery, we go through different diet stages. We cannot have a grilled piece of chicken right after surgery, so you do have to, transition. However, if we're 6-7 months out and you're still relying on soft foods, this is where your pouch gets a little bit more comfortable, and we're probably having a little bit more volume, whereas more solid foods will help you stay fuller for longer. You'll be more satisfied with maybe a smaller amount than the soft version of that food. So again, food journal. This is where it all comes down to. And then very common that I see here in practice is grazing. So what is grazing? Grazing is just eating random little things throughout the day, here and there. Maybe they're healthy, maybe they're not, but we're not having that scheduled 3 meals, a snack or 2 in between, right? So again, we want to come back and make a game plan and be like, okay, I tend to skip breakfast, or I tend to skip lunch, or I'm bored, or I just don't have time to prepare for meals. So again, coming back and seeing me can help you be on track, and we can create a plan and get back on track there. Number 2, that's the nutrition point of view. Now we're moving into physical activity, right? So of course, right now we have the challenge going on, which is why we did this, because holidays are here and sometimes we can get a little too comfortable with the couch. So it's always really important to get some sort of physical activity there. During weight plateaus or weight regain, the trend is either we're not doing enough physical activity, or we are doing some, but it's a little bit of cardio here and there, and we're not focusing on that strength training, right? So with strength training and of course your protein intake, you want to make sure that you're building, your lean muscle mass. Whenever we have more lean muscle mass than fat mass, then just at rest, we're more metabolically active. So changing up the exercise, maybe you're doing just, walking, maybe a little bit of jogging, trying some strength training at home, maybe doing something like a HIIT class or like dance. I know some of you have been doing like dance classes, trying, studios like maybe like Orange Theory, which is a lot of, strength training and cardio, things like that. And then moving into the psychological factors. I can have some input here, but then of course, if it's more of, deeper problems, then definitely following up with, like a psychologist or, a therapist can help you, cope with and, with the feelings and maybe, find some mechanisms to, help you get through that rut. But, most common is, the emotional distress. So if we have a, change in, your life where maybe you're going through a lot of stress, maybe there's some depression going on, maybe somebody's sick at home or something where that's changing up the routine, right? And then we have, of course, the lack of support. So this is why we do this, kind of videos, and we have the support group, and we're missing you in person, but hopefully at some point next year we will, because not a lot of people understand what a bariatric patient goes through post-op. It's a big journey, and there's a lot of things that people who are not familiar are not going to understand. Or maybe there are some people that they choose not to tell, friends, they don't choose to tell co-workers, they don't choose to tell family other than maybe your spouse. So of course, relying with us, we're here for you, we're like your cheerleaders, and then of course, having the support of, your support groups and other people that have gone through this. And then very common that we see here is the lack of adherence, right? So we can be very compliant at the very beginning, but then maybe 6-7 months out, forget what Karla told you, you forget what Dr. Thomas told you, or maybe we just saw you 2 weeks out of surgery and then never heard from you. So right. This is where maybe we're straying off a little bit as to what you're doing. So of course, we always advise to stay on track with your appointments, come see us on those, scheduled times. And then of course, anytime, in between those appointments, you are more than welcome to come in. It's really helpful for that, adherence and maybe have that accountability with us. And now we are onto your part.
So from my point of view, when a patient comes in and starts asking questions about weight regain, the first thing that I want everyone to know is that a little bit of weight regain after bariatric surgery is totally normal. So if you look at the weight loss curves of someone that's had either a sleeve or a gastric bypass, the timelines are a little different, but most people lose weight for the first 12 to 15 months after surgery. Everybody is going to reach a low point, and everybody is going to gain about 5 to 10% after that low point. So, everyone will see some weight regain. This is totally normal and a part of normal bariatric surgery. The first few things that I ask questions about are, one, the diet. Clearly, that's the first thing we're going to go to. So, are you eating very nutritionally dense, like high-calorie foods? Are you adapting your eating behaviors to accommodate a smaller stomach, such as like eating smoothies or high-calorie foods that are liquids, perhaps? Also, I'm going to ask about exercise. So what kind of exercise are you doing? I suggest people switch it up. Walking is great, but ultimately walking is not going to get us to where we want to get probably. Most people are going to need to do some sort of exercise that gets people to sweat, that gets their heart rate elevated, and I want them to do that for 30 minutes a day for at least 5 days a week. That is really going to aid in getting over these plateaus. If none of those things are an issue, then we're going to look at anatomical factors. So the first thing that I'm going to do is probably order an upper GI or even maybe an EGD to look at what the sleeve looks at, what the gastric bypass looks at, or what it looks like. and how big that anastomosis is. Certainly, sometimes that can be a factor in plateaus. And so we're gonna, there are some revisional, there are some situations where revisions might be appropriate. But most of the time, an upper GI will reveal that things look anatomically normal. And so in those situations where everything looks normal and there's no major things to correct in your diet or exercise, sometimes an appetite suppressant can be helpful. And so there are a few situations where I use appetite suppressants in patients that have had bariatric surgery, have hit a plateau. Actually, I had one in the clinic today, and Qsymia has been very helpful to get her over those, the 10, 15 pounds of extra weight loss that she's been looking for. So those are the kind of the major points. So first would be diet, second exercise, and then third anatomical, looking for problems with the bariatric surgery that we could potentially correct with a endoscopic or minimally invasive procedure that kind of gets you over that plateau. So I think that's pretty much all I have. Mm-hmm. Does anyone have any questions, any concerns, anything that they want to share through the messages?
We're open for questions, so just you can type it out and we'll read it out and discuss it with you. One very common question that I get in clinic.
Hang on, there's a message here. Mm-hmm. Okay, with the COVID-19, okay, let's see. Let me see if I can find these questions. No, there's no questions yet. They're just comments. Okay.
Okay. Well, while we wait for some questions to come in, hopefully, one very common that I see here in practice is can your stomach stretch?
Yes. So that's a good question. Actually, a lot. So if you ask 10 different bariatric surgeons, you'll probably get 10 different opinions on this. My opinion is consider someone that's had bariatric surgery that does something called a pouch reset. Most people have heard of this diet. It's basically going back to the liquid diet for 2 weeks or so, and a lot of people feel like this resets their feelings of satiety. And so my thoughts on that are that after you do a pouch reset, you feel full quicker, right? But you don't feel full quicker because your pouch is actually smaller. You feel full quicker because you're receiving those signals from your stomach to your brain that are telling you that you're full at a different set point. You've basically reset your brain to feel like it's full at an earlier point. So that relates to the size of the pouch because the pouch hasn't changed, but your feelings of fullness have changed. And my thoughts about the pouch stretching are that it probably doesn't stretch. Certainly that's something that we can look at through an upper GI or endoscopy. But it is, eating is so closely linked to our brain that it is probably those feelings of fullness that you're not getting because you have gradually started eating more and more over a period of time. And sometimes going back to that original liquid diet can be helpful.
Yeah, only meant to be done for a short period of time because you again don't want to stay there very long.
True.
You're hopefully a little bit out of surgery, and so we don't really need to do all liquids again. It was bad the first time. Why would we need to do it again?
Yeah. Well, even if you don't do liquids, my thoughts are that your pouch should be the same size. So maybe look at portions and cutting back instead. That might be, that might be more helpful. Maybe not liquids, but certainly cutting back.
Mm-hmm.
So.
Yeah. Well, let's see if we have any questions. Let me scroll down. Okay. Can you answer what is anastomosis?
Sure. So an anastomosis is a connection of bowels. So it could be either your stomach to your small intestine.
There we
are. Okay, so it could be, I don't know, we cut out for a second. So anastomosis could be either the stomach connected to the small bowel, or in certain situations, the small bowel connected to the large intestines, or even Anastomosis is a word used generally in surgery to refer to connecting two things. So it could be two blood vessels, but usually in bariatric surgery that implies a connection between the stomach to the small intestines.
Should I still be eating slowly after a year and a half? And no drinks 30 minutes before and after meals?
Yes. So again, it's gonna help with that, feeling of fullness with the meals. Usually when let's say that you're having your water or your unsweet tea or whatever you're drinking, and then right after you start eating, then you're probably not gonna eat enough of that food, and you're gonna feel fuller for longer. If we keep pushing that, then they can probably come back up the other way. And then the same thing around. So if you eat and then right after, try to drink water, that water's probably going to come back where it came from. Eating slowly, yes. So sometimes at the beginning, the focus is on getting your stomach to, try to tolerate foods again, but a lot of the post-op is also on the mindfulness of it. So if we're kind of watching TV or you're on your phone and you're eating and maybe not paying attention to how fast, then probably one, you can get a little sick by eating an extra bite. And number two, we're not paying attention to our portions. So if I have a bag of almonds next to me and I'm watching TV and I'm just doing this, then I am probably gonna finish a whole bag if I'm not paying attention. So yes, chewing is still a thing, and waiting the 30 minutes before and after is still a thing.
Can you have regain if you start lifting weights, at least initially?
Usually, you have to lift a lot of weights, but you do tend to gain a little bit of weight, but do keep in mind that that's muscle weight. So it's very different from, gaining fat. So yeah, you may see a little bit, but if you're, trying on new clothes or anything, you should still feel like that, shrinking from your waistline or whatever.
I've also heard we shouldn't really work out hard until we can take in enough calories. Is that true?
In a way, yes, because of course, right after surgery, if you're, let's say 1 month or 2 months out and you're trying to train for a marathon, you're probably not going to have enough calories in. If you're about a year out of surgery, you should be having enough, calories in, and you should be able to tolerate enough food to, let's say, train for a marathon. With physical activity, it's always good to, gradually increase. And I always recommend, looking at, maybe smaller snacks before and after, just so that you can get that, energy for, for doing your workout, and then afterwards to replenish some of that muscle that you worked out.
What happens if I do not qualify for weight loss surgery? How can I lose weight?
Well, so that's a good question. There are other methods of weight loss besides surgical weight loss. So to qualify for bariatric surgery, you have to have a BMI over 35 with a comorbidity. And a comorbidity includes something like diabetes, high blood pressure, sleep apnea, high cholesterol, coronary. There's a long list of those things. Or a BMI over 40, and you don't have to have a medical comorbidity to go along with it. So there are patients certainly that have a BMI between 30 and 40 who don't qualify. Maybe they don't have a comorbidity, or even their BMI is less than 35. Those patients might consider an appetite suppressant. Combined with a visit with Karla to talk about their diet, and then I always encourage patients to log their food when they're in this situation, to start exercising, and I do have some patients that have meaningful weight loss on an appetite suppressant, so that would be another alternative. We're happy to sit down and talk about those things too.
I started drinking diet soda on occasion, 1 soda a week. Is it a myth that carbonation stretches the sleeve?
So carbonation is probably going to make you feel full and bloated very quickly. It's probably not a great idea for someone that's had bariatric surgery, at least for I don't know, how long do you recommend they don't drink any sodas?
I mean, I say ever, but
Really? So I say for, I mean, at least 6 months, or so that you don't have a soda because of the carbonation. Is it going to stretch out the pouch? It's probably not going to stretch out the pouch. I mean, like we said earlier, in my opinion, when we go back and do like an upper endoscopy on someone that's had a sleeve, even years ago, their stomach is generally still the same size. So can the stomach learn to accommodate more types of food? You know, our stomach is a stretchy organ, right? It's supposed to stretch when we eat. Perhaps there is some increased accommodation as you recover from surgery years later, but the size of the stomach physically is the same when we go back and look later. So, I mean, you know, it's kind of a soft answer to give you, but no, probably it can't cause your stomach to stretch.
How many calories should someone 9 months post-op or more be getting per day?
That's a very good question. It's going to vary from person to person because it will depend on your level of physical activity, you know, your height, your current weight. But typically I work with ranges. So usually somebody who is about 9 months out of surgery should be getting anywhere between like 1,000, you know, maybe up to 11 or up to 1,200 calories in a day. Most important is to always look at the protein intake, make sure that that's balanced out. But then also the level of physical activity that can change too. So if you're 9 months out, but you're, you know, working out, you know, 5-6 days out of the week, and you're doing, you know, something that, you know, you're gonna burn a lot of calories, you probably need a little bit more than that. So always come in and check with me. We can sit down and talk about it.
How much of this journey would you say is psychological?
Wow, that's a good question.
Yeah.
A lot. Certainly, eating is very tied to so many social behaviors in our culture. It's also tied to our brain very closely. A lot is related to our brain. I would say that a lot of people could benefit in, you know, after everyone has to go through a psychological evaluation for bariatric surgery, but many people don't go back and touch bases with that person after they've been through this whole process. So, you know, that's always an option too, is for someone to go back and see the psychologist or the psychiatrist, or, you know, that's what our support group is there for ultimately, is that social support, because we all need a little bit of help. Okay, guys, I think this about does it for our first Facebook Live event. Thanks for tuning in, everyone, and look forward to doing another one sometime soon. Y'all take care. Let us know if you need anything. Bye.
Bye.
Bye.